I'm Greg McMahon, consultant vascular surgeon at Circulation Clinic, the artery and vein specialists. In the following short video, I'm going to be discussing varicose veins and how we can treat them. Probably one of the first and most important things to say about varicose veins is that they are very common. In fact, about 1 in 3 of us are affected by them, making them more common than blue eyes. The word varicose describes the dilatation of a vein, and that could theoretically be any vein in the body. But it is in reality usually a vein in the leg. And this is because of the pressures exerted on the leg veins by our upright, vertical standing position. To understand why varicose veins occur, it's probably worth recapping how the circulation of the leg works. The circulatory system essentially consists of the heart, which pumps blood away at high pressure through the arteries. In the leg, flow goes from groin to foot in the arterial system, and it goes only one way, from top to bottom. The arteries gradually branch and divide into increasingly smaller vessels, down to the microscopic level, before the veins pick up the circulation to take the flow back up the leg, from foot to groin, and back up eventually to the heart. The venous system in the leg is arranged in a parallel fashion. The deep veins are large vessels inside the leg, and the superficial veins lie just beneath the skin, and are the veins in which we tend to see varicose change. And just as with the arterial system, flow in the veins should be one way only, with the flow moving upwards. But with this in mind, there are a couple of issues that have to be overcome. Firstly, all that pressure generated by the heart on the arterial side has now been dissipated through those microscopic vessels, and the pressure inside the veins is therefore much reduced. Couple this with the fact that we're now working against gravity in having to move from foot to groin, and you can start to see how the circulation might struggle to maintain that one-way upward flow. But there is a mechanism in place to aid transport up the leg. Dispersed throughout the veins are small valves which open to allow upward flow, but then snap shut to prevent the circulation going back the wrong way down the leg, or refluxing. This way, the flow gradually makes its way up the leg between each valve. A neat solution, but the problem with it is that it's common for the valves to fail, either because the valve itself degrades or because the walls of the vein become flaccid, meaning that the valve can no longer effect a seal. This then allows reflux in the vein, a sort of short circuit if you like, which allows the flow to go back down to the next valve in the circulation, which then itself fails because it's struggling to deal with 2 sections of the circulation rather than just its own. Eventually all the valves fail like a falling stack of dominoes, and the mechanism for promoting one-way upwards flow is lost. We now have superficial venous reflux, and the circulation in the superficial veins has reversed. And this puts abnormal pressure on the veins, causing them to dilate and become varicose. For some people, there is a cosmetic impact from their varicose veins, whether this is the so-called thread veins in the skin or the more prominent varicose veins. The back pressure transmitted down the refluxing veins and down into the very small veins in the skin can cause abnormal pressure to be exerted there, which can start to affect the skin itself. This can lead to varicose vein related complications such as skin staining, eczema, or ulceration in the worst case. But these are actually relatively unusual occurrences, particularly ulceration. There are also lots of other symptoms that can sometimes be attributed to varicose veins, which range from heaviness of the legs, aching, itching, swelling, and tingling. Often when the varicose veins are treated, these symptoms do improve or resolve completely. Your vascular specialist will start by discussing your varicose veins with you, as well as your past medical history. They will then examine you, undertaking a full vascular assessment, including of your arterial system, by checking the pulses in your abdomen and legs. They will assess the varicose veins themselves, and this is often best done with you standing up to replicate the pressure in the veins and demonstrate them at their most prominent. Usually the next step is to perform a scan of the legs to assess the exact anatomy of the veins. And this also allows us to visualize the deep veins, as these can't be assessed on physical examination. This test is called a duplex ultrasound scan and uses a handheld ultrasound probe to visualize the vessels. It's vital in the planning of any subsequent intervention. Sometimes the aching of varicose veins can be eased with elasticated support stockings, as these can provide relief to the stretching pressure on the vein wall. Having said that, some people find the stockings uncomfortable to wear, and many report them to be particularly unpleasant in hot weather. And of course, stockings can only relieve the discomfort. The varicose veins themselves won't go away with this treatment in isolation. There are a number of options for definitively treating varicose veins, and your vascular specialist will tailor an approach after careful consideration and discussion with you. Sometimes the available treatment options depend on your specific venous anatomy. When thinking about intervention for varicose veins, it's important to remember that the faulty veins are not contributing to the venous circulation anymore. Why is this relevant? Well, the aim of any varicose vein treatment procedure is to stop the reflux, the backwards flow, in the affected veins. And we do this either by separating the superficial vein from the deep vein and removing it, or by sealing the veins from within. Because the varicose veins are no longer usefully contributing to the circulation, this causes no detriment, and the venous circulation from foot to groin is maintained by the deep veins. Whichever approach you decide on, most varicose vein procedures are carried out as day cases, with no requirement for an overnight stay. Many of them can be performed without the need for a general anaesthetic. Where one of the main superficial venous trunks is refluxing because of a failure of the valve system, one option is to perform open surgery to disconnect the superficial veins from the deep veins, which usually does require a general anaesthetic. Most often this is achieved either through a small incision in the groin or behind the knee, depending on which superficial vein is the source of the varicosities. The venous trunk can then also be removed or stripped, and the troublesome varicose veins themselves can be excised through small incisions. The alternative to open surgery is one of the minimally invasive or endovenous ablation procedures, which are usually performed under local anaesthetic. To treat a refluxing vein, a thin catheter is passed inside the vessel through a small incision in the thigh or lower leg. We'll use ultrasound imaging to guide us. The tip of the catheter heats up, either by way of a laser or a heating element. The heat causes the vein wall to become sticky, and by wrapping the leg afterwards in a bandage, the vein can be effectively sealed, preventing any ongoing reflux. Varicose and thread veins can also be treated with a minimally invasive therapy called sclerotherapy. This is also performed under local anaesthetic as a walk-in, walk-out technique. It involves injecting a substance called a sclerosant directly into the problematic veins. In many ways, this works the same way as the endovenous ablation techniques, in that the sclerosant makes the walls of the veins sticky, allowing them to be sealed shut when a bandage is applied. With this technique, it's common for more than one episode of treatment to be required. Like all medical interventions, procedures for varicose veins do carry risks of complications, and your vascular specialist will discuss these with you in more detail. Suffice to say, most complications are thankfully rare. You will usually receive an anticoagulant injection immediately on completion of any operation, and your vascular specialist will strongly encourage you to keep active and mobile in the post-operative period. This is to help reduce the risk of you developing a deep vein thrombosis or clot in the vein. Here at the Circulation Clinic, we pride ourselves on delivering first-class assessment, investigation, diagnosis and treatment of peripheral arterial and venous disorders.